Transitioning from one thermal modality to another, going from cold to hot.
As we have previously examined the uses of cryotherapy and thermotherapy, it is also important to discern when a clinician should transition from ice to heat during a treatment of a patient. Many of us automatically will start with ice or cryotherapy in our initial treatments, but many people wonder when it's appropriate to transition a patient to heat. There are some things that you should remember when trying to determine if heat is appropriate. Unfortunately, there isn't any predetermined time frame for the transition, and as some people say, there isn't any cookbook medicine plan for treatment. You need to observe the patient's signs and symptoms. As a clinician, you will need to determine where the patient is at in terms of the healing process. You will also need to think about the desirable physiological responses to determine if heat is appropriate. There is one important rule to using thermotherapy. Heat should never be applied immediately after an injury. The most important initial goal of the injury process is to limit secondary injury by decreasing cellular metabolism and the release of chemical mediators and to decrease pain. Thus, heat is contraindicated for acute injuries. As the injury progresses, we may choose to start employing heat as a modality to help increase joint range of motion, blood flow, and cellular metabolism. If motion is restricted due to pain, we will continue to use cryotherapy. For the care of subacute injuries, we may begin to use both heat and cold. The treatment effects of thermotherapy are an increase in tissue compliance, blood flow, and metabolism. Tissue elongation is also desirable to restore range of motion the patient has lost, and our goal as a clinician is to continue to decrease pain and spasm. The typical protocol is to heat before and then ice after treatment. This is very common in physical therapy, occupational therapy, and athletic training. The following questions can also be helpful in guiding a young clinician to evaluate whether heat is appropriate for their patient. These questions are found on page 132 in Table 5-10 in the Starkey text. If all the answers to these questions are no, then heat can safely be used. As the number of yes answers increases, so does the indication to use cold. Number 1, does the body area feel warm to the touch? Number 2, is the injured area still sensitive to light, moderate touch? Number 3, does the amount of swelling continue to increase over time? Number 4, does swelling increase during activity? Number 5, does pain limit the joint's range of motion? Number 6, would you consider the acute inflammation process to still be active? Number 7, does the patient continue to display improvement with the use of cold modalities? Just as a general review, if motion is limited by pain, then cold should be used. If the motion is limited by stiffness, then heat should be used. When in doubt, use cold. As a practical application, here is a scenario for you. You have a 19-year-old patient with an ankle sprain. The injury occurred approximately 3 days ago and looks something like this. The patient's injury is warm to the touch and he is still complaining of significant pain. You can see from this picture that the patient has a significant edema and ecchymosis. Therefore, at this point of the treatment, we should stick to cold treatment since there still appears to be active inflammation. After 4 visits to the clinic, it has been nearly 2 weeks since the original injury. The edema has decreased, but there's still a little bit there. The injury is no longer warm to the touch. The patient is now complaining of stiffness and decreasing the range of motion during walking. At this point in the treatment, we should use heat as the treatment. After 6 visits to the clinic, it's been nearly 3 weeks since the original injury. Your patient comes into the clinic and states that he played a pickup game of basketball last night and he tweaked it again. The ankle is warm to the touch and there is visible edema present in the joint. At this point in the treatment, we should re-switch back to cold as a treatment due to the reinitiation of the inflammatory process. It is important to remember that we do not have to eliminate cold treatments at any point during the rehabilitation process. We can always go back to cryotherapy. And remember, when in doubt, make sure to use cryotherapy.